I'm Zac Watkins. I'm a functional medicine doctor and a clinical nutritionist. And my hope and goal is to basically show people the root cause of their illness and how they got to where they are with symptoms and disease. They will call and we set them up for an appointment. What happens is we'll come here and we're gonna spend about an hour discussing kind of what your needs are. What are your wants? We know that you have symptoms, whatever they may be, fatigue, history of cardiovascular disease, whatever, that's all important, but what are your real needs and your underlying desires? My hope is not just to be the person telling them what to do and then they leave the office and go do their own thing and we're good. My hope is that I'm giving that person direction and clarity and hope that there is a reason that they've had multiple years of these things, or there is a reason that weight changes have occurred or hormone changes have occurred. But we have to investigate that. So when we find the answers that we're looking for, my job with the individual is to say, look, I'm here to help you and coach you and direct you. Because most patients are very educated and they're very smart and they understand what's important for them. I'm not gonna lie, it is a lot of hard work, but obviously anything that's worth attaining is not gonna be easy. So when we spend that time together and we find out a roadmap or steps that we need to take for that person's optimal health and what we need to do, a lot of it lies on them now. And my hope is that they can sit down and they can think about what they truly want, not just I want to feel better or I want to have more energy. You have to know the why of what you're doing. I want to have more energy because I want to spend time with my kids. I don't want to be tired because I'm very productive at work and I have a good business and I want to keep that going. So it's not easy. You have to change your diet. There's some dietary changes that we expect because that's very foundational with transforming someone's health. We talk about changing lifestyle patterns, which usually involves habits. If it's sleeping at a different time, if it's not eating 10 minutes before bed, just taking steps that we've been used to get different results. And so my hope and goal for that person is to say, are you willing to do these things? Because then I can show you what steps we need to take. We're trying to really lay a foundational approach and give the body what it needs. We need to, one, understand where that person is now, and we do that through objective lab data, lab testing to give us that picture. But two, we use things like vitamins, herbs, and minerals, but now we know why. It's not that we're guessing or we say this is good for this, or we've heard and read that this might be effective, because that's not how it works. You're unique, each person's unique in their own individual ways, and we need to view that and see that. So if people want to learn more, I invite them to check out the resources on my webpage and sign up for my newsletter.